public procurement is always marred by some kind of observations that, okay, how do we balance quality versus just the cost? And GeM being no different also. What are the plans in actually bringing in some of that quality aspect from a design stage when you are trying to do e-procurement?
So, yeah, thanks for this question. Actually, the public procurement on the platform is based on categories. So what is very essential is how we write a category. Okay, a particular category, meaning thereby the golden parameters, the technical specifications that go into the making of categories. So we have like just as BIS has its technical committees and consultative committees, we also have something called a CCM. In fact, for medical devices, we've had almost 90 plus CCMs where the OEMs could get an opportunity to talk about what should go into a category. So the first and foremost step towards ensuring quality is how do you write a category, how do you write the technical specifications, and if this category has some regulatory aspect, let's say the regulator has said that only certain people who are holding the, let's say, CDSCO license or there's an ISO certification required, that is then made part of that category specs. So only those people who would have that kind of certification would be allowed onto the platform. Fortunately or unfortunately, we do, quality being equal, we would give preference to whoever is quoting the lowest of price. So that is something that comes from the government's directive and we can't wish that away. But yes, we are conscious of the requirements of buyers of quality, and we are doing as much as we can. If there are any concrete suggestions, you're most welcome to give us here or later.
Thank you so much, Mr. Chavan. So basically it depends on how the categories are created. How do you differentiate a category to make sure that if there is any quality aspect, it can be incorporated in itself. And that will help in the procurement process.